I wanted to ask you if there are any issues that you may be uncomfortable in discussing with the patient regarding perhaps the dialect that she uses compared to the language that you're accustomed with, or if there are any issues regarding religion or spirituality that you might find a conflict or uncomfortable to discuss with her?
No, there's nothing really that I can imagine that could come up in this type of. I've done this type of encounter before, and so I understand, you know, in broad strokes what could happen. I understand her dialect perfectly well. We understand each other perfectly well. She's an educated woman, so I have found when we were at registration and then outside in the waiting area that we understand each other fine.
Are there any issues that you might be uncomfortable discussing with her regarding her breast cancer, or some of the issues that often in some cultures are only discussed amongst women? Do you think there might be any issues of embarrassment between you and the patient, or even you and myself?
Yeah, that is one thing that I'm glad that you asked me, because I wanted to point out that I think that she might be a little uncomfortable in this situation by virtue of the fact that I'm a man and the interpreter is a man. So I would try to just encourage you to establish your communication with her. I'm going to try to sit out of the way so that she, to the extent that she can put me out of her mind and really establish a communication with you. I have sensed just from being outside in the waiting area with her that she might feel a little embarrassed to have these types of issues that involve her private life discussed with a man.
So let me just understand, do you feel that it might inhibit the consultation if you sense a discomfort from her to you, or vice versa? Do you feel that this might become an issue where perhaps we should ask for a female interpreter?
Well, you could. Since I'm here and since she's here.
You suspect, although you're not sure, that there might be some issues of discomfort when we start speaking about some of the female issues associated with her breast cancer, her sexuality, her fears, and that if you sense a discomfort from her, you will let me know, and if there's certainly a discomfort on your part, you will also let me know?
Absolutely.